Today, Guilford County pre-K through second grade were supposed to be heading back to class for full re-entry, but that did not happen. As of yesterday, the district needed to postpone their re-entry plan after the county health department identified increases in coronavirus data. We know that a lot of you have questions about how all of this is going to continue to work. You can text your questions to 336-379-5775. Just remember, only text these questions. You cannot call them in. These are text only. All right. So with us today, we have Guilford County School Superintendent, Dr. Sharon Contreras, Dr. Nora Carr, the Guilford County Health Director as well. Dr. Julia Van is joining us so that we are able to answer your questions in the best way that we can at this moment. All right, so we are going to start. We're already getting some text questions here. This first question is, why are pre-K and kindergarten teachers being asked to teach voluntary half days and also having to submit online assignments for students not attending?
I want to make sure I heard the question clearly. You said, why can they teach voluntarily?
Half days, but also have to submit online assignments for students not attending.
Why can't they do that?
It says, why are they being asked to do that?
Because of staff.
Yeah, it's a matter of staffing. And remember, teachers work a full day. So the kindergarten classrooms right now are 3 hours. And then teachers are still working a full day. So we are not doing this widespread, but we do have students at home that we are obligated to teach. And we don't have additional staff to provide 2 sets of teachers for students. We wish we did to lighten the burden of our teachers, but we simply don't have enough staff.
Mm-hmm. And this is something that, again, everyone is trying to get their hands around all of this as we go. This next question is, if pre-K through second grade do not return next week, will there still be voluntary half days for pre-K and kindergarten? And if so, why?
At this point, yes, there will be. We do not intend to close down unless there is a cluster at a school that prevents us from allowing students and staff to enter a building.
All right, well, let's kind of jump off on that point when we're talking about COVID clusters and things of that nature. The whole impotence for what happened over the last 24 hours is because the metrics changed. So, Dr. Van, can you speak to that?
Sure, absolutely. So, as we have been working with the school system for a while now around the metrics, my team has been keeping a very close eye on the metrics that the Board of Education has decided on in order to make the transition and staggered approach towards the reentry of the kids in the classroom. We have been seeing the numbers going up, and in all of the metrics that we have discussed with the Board of Education. One of the core metrics that we have been looking at is the number of new cases that are reported to us daily. In the last couple of weeks, we have seen 2 days with very high number of cases, specifically October 5th with 145 new cases for that day, and October 12th with 129 new cases, which are the highest 2 days of cases that have been reported to the health department since the beginning of March. Also, we have seen an increase in cases during those 2 weeks continuously, which has not been seen since beginning of July. So that has been one of the first things that we've noticed. The positivity rate has also increased for the 14 days that we're analyzing, and at this time it is at 6.5%. And the Board of Education decided to take a more cautious approach and look at the positivity rate for that to be below 5%. So that is going up. Also, in the numbers that we're seeing for hospitalizations and ICU admissions, those are also going up in the same fashion as the new numbers, the hospitalizations have not been this high since July of this year. So we're seeing an overall uptick of all of these different core metrics. And that has prompted us to have a conversation with the superintendent and the Guilford County Schools leadership to give them the best data that we have in order to help them in the decision-making process.
And so there's a follow-up to that. Is there a magic number when it comes to numbers of cases? What do we want to see so that the kids can go back to school?
Yes, and I know that that has been a question that we have received for a while now, and unfortunately I am not able to say that there is a magic number. I wish there was a magic number, and I wish there was this perfect place and perfect world in which we can say that if this happens, if X number is met, then we believe that that risk of transmission is not that high. So we need to look at all of the numbers, both in the number of new cases that we're seeing, the hospitalizations, the positivity rate, all together. We also want to see a downward trend in the data. Sometimes there will be upticks in the numbers, daily numbers, but we want to see the downward trend. That's what we were seeing at the beginning of September going forward when we've had the first conversations with the Board of Education around metrics. Since then, all of those numbers have started going up, and they're up every day, and they're up as a trend as well. So we're continuing to look at these together as a whole, holistically, because each one of them tells us a different aspect of the community transmission.
Okay, so what we're talking about here is not only the daily numbers going up, but then the overall trends going up, and that was the impotence for that, because before we were seeing maybe some daily trends going up, but the trend was down, and so that has changed since September. Okay, all right, we're going to continue to take your text questions and get our arms around what's happened in the last 24 hours and then what's going to happen as we move forward with Guilford County Schools. You can always text your questions 336-379-5775, and we'll be right back.